When you're ready, you can tell us.
Okay, ma'am.
You've done reading?
No.
Okay, then read, please. Once you're ready, then let us know, please.
Okay, I'm ready.
All right. Okay. So if you've read and understood, considering it communication skills station, please begin.
Hello, I'm Dr. Kamal Ibrahim, one of the doctor working for Mr. Man at Scully Hospital in London. May I confirm I'm speaking with the ITU registrar?
Yes, I am the ITU registrar.
Thank you. I'm calling on respect of a 78-year-old woman who we're managing for Perforated Viscus. So I'm calling to seek for your advice, for your preoperative advice, and possible book ITU bed for the patient postoperatively.
Yes, okay, go ahead.
Okay, thank you very much. Is a 76-year-old woman, known chronic obstructive pulmonary disease patient on steroid. He presented with sudden onset of abdominal pain, and also there is associated drowsiness. Examination revealed abdominal tenderness, and with then investigations done some blood investigations, and we make a diagnosis of perforated viscus. A patient will require an urgent laparotomy. So I'm calling you to get some advice so that we know what we can do preoperatively while we are working patient up for surgery, and to book patient for ITU, postoperative ITU.
Okay. So can I know why do you think it is a perforated viscus?
Good.
Yes, because patient gave history of sudden abdominal pain, and also on examination there is generalized abdominal tenderness. Also, the chest X-ray that has been done shows patient has hair under the diaphragm.
Okay. So any other blood investigations that have been done?
Yes, patient has had complete blood count and electrolyte, urea, and creatinine. The complete blood count, there is leukocytosis, and electrolyte, urea, and creatinine patient has hypokalemia.
Okay. And what about the ABG?
What is it?
What about her arterial blood gas?
They have done arterial blood gas analysis that shows metabolic acidosis.
Okay. So has the fluid resuscitation been started?
Yes, we've commenced patient on a fluid resuscitation, has had starting 1 liter of crystalloid, so rush over 1 hour. Then we'll assess the vital signs.
Okay. So so preoperatively you have done all the tests. Preoperative alignment.
Yes, we've also done abdominal ultrasound that shows free peritoneal fluid, free intraperitoneal fluid, which is also in keeping with possible of viscous perforation.
Okay. So is the patient at present on oxygen or anything like that for COPD?
Yes, we'll place the patient on oxygen. However, we'll consider because the patient has chronic obstructive pulmonary disease, we'll put on oxygen and let's be on low saturation because of our condition.
So how much FiO2 you're delivering at present to the patient?
21%.
21%. Okay. And what about the hypokalemia? Like, are you doing something for it?
Yes, we'll plan to do electrocardiogram (ECG)
Okay.
to look out for possibility of atrial fibrillation because of the tachycardia the patient has as well, and also
Okay.
to see if there are features of hypokalemia. Then we're also planning to correct the hypokalemia as well.
Okay. I just wanted to tell you one thing, probably a bad news for you, that there's only one bed and there is one asthmatic young lady who's coming directly from the A&E. So would you can you manage this patient in the recovery room for some time?
Yes, while we post-operatively will manage patients, monitor the patients in the recovery room. At the same time, speak with the bed managers if they could repartition the bed or if there's any patient that can probably be moved to the ward or HDU while our patient can come in. But in the meantime, while we're waiting for that, we'll manage the patient or monitor the patient in post-operative.
Sure, I'll let you know once the bed is empty.
Okay, thank you very much.
Thank you.
So is there any other thing you'd like me to do for the patients?
Yes, can you check if the patient took steroid inhaler today?
Okay, I'll do that and get back to you as soon as possible.
What about the patient's vitals for the monitoring? How frequently are you monitoring patients' vitals?
I'll do that one hourly, and also I'll categorize the patient to monitor the urine outputs, and also to check the vital signs hourly.
Has patient been given antibiotics?
I will confirm that and get back to you. However, we're going to make sure we put the patient on antibiotics, so prospective antibiotics.
When are you planning to repeat chest X-ray for the patient to look for the free air?
Yes, the initial one done does not show free air.
Yes.
However, we're planning to repeat it to see if there's going to be any signs of.
Preoperatively, who would you contact regarding the patient?
Hello?
Yes, preoperatively, who are you going to contact?
Yes,
in view of patient's COPD complications postoperatively?
Yes, we'll inform the anesthetist to be aware of the patient. We'll also call the pulmonologist.
Yes. Postoperatively, has patient seen physiotherapist?
Yes, the chest physician will commence physiotherapy preoperatively and also postoperatively.
Okay.
Yes, ma'am.
All right.
Then I also pass nasogastric tube to decompress the stomach for the patient on crystalloids for the patient, monitor vital signs closely.
Right. Before you send your patient, can you tell me what is the criteria for the admission of patient in ITU?
Yes, patient that require 1:1 nurse to patient ratio.
Yes.
And patient with 2 organ system that with acute reversible cause. Patient with respiratory failure that require mechanical ventilation. Patient with 1 chronic organ failure and an imminent acute organ failure.
Yes, and possible second being failed. Good. All right. Do you think your patient fits this criteria for ITU admission?
Yes, the patient. Yes, ma'am. The patient has. Yes, ma'am.
All right, then you can send. How much blood have you arranged for cross matching?
We haven't arranged any. However, we'll make sure we group and cross match and save 2 pints of blood.
All right, good. All right. So I'll let you know when bed is available, then you can transfer your patient. Thank you.
Okay, thank you very much.